welcome folks. My name is Patrick Gaskin. I have the honor of co-chairing the CND OHT Steering Committee, and on behalf of my co-chair, Chris Casalato, and the OHT staff, I offer a warm and sunny welcome to you to this celebratory event. This is the Cambridge North Dumfries Ontario Health Team's third year in review event, our annual opportunity to come together as an OHT community to pause, reflect, celebrate, and look ahead. This year, the theme for our event is primary care, an anchor of our healthcare system. The theme was chosen to celebrate all the advancements related to primary care that have taken place in our OHT this year, and to recognize the importance of primary care as a sector, and in particular, primary care clinicians in advancing the work and the success of the CND OHT. As such, I want to formally welcome all the primary care clinicians today and thank you for the work that you do. We also have a few special guests with us today. I saw on the screen Mayor Foxton. Welcome, Mayor Foxton, Mayor of the Township of North Dumfries. We always appreciate the support you give to the OHT, to our member organizations, and more broadly, how you recognize that the work we do has strong links to the success and well-being of your community. I also think we have with us today from Ontario Health West, Jennifer Peckett. Jennifer is the Director of Health Equity and System Transformation. Thank you, Jennifer, for joining us today and for the work that you do to help advance the OHT goals. As we embark on the month of June, I want to take a moment to highlight that this month is both Pride Month and National Indigenous History Month. Recognizing these months is not only an important symbolic gesture, but is also an opportunity to create space to acknowledge and learn so that we can advance our shared goals as we continue to develop an equitable health system and support equity-deserving communities. The CND OHT is very fortunate to have strong patient, family, and caregiver partners. And today I'm grateful to invite Lucy Santa Maria, the chair of the CND OHT Patient, Family, and Caregiver Advisory Council, to provide the land acknowledgement. Welcome, Lucy.
It's a pleasure to be here on this beautiful day. Today we acknowledge that the lands on which we gather are traditionally used by the Haudenosaunee, Anishinaabe, and the Chinootan people. We also recognize the enduring presence and deep traditional knowledge, laws, and philosophies of the Indigenous people with whom we share this land today. The Cambridge North Dumfries Ontario Health Team recognizes we are all treaty people. With the responsibility to honor our relations and live with each other in kinship. The CND OHT, as well as our partner organizations, uphold the initial intentions of the treaty to the best of our ability. And back to you, Christina.
Thanks so much, Lucy, and thank you, Patrick, for those opening remarks as well. For those that do not know me, my name is Christina Eliashevsky. I'm the director of the Cambridge North Dumfries OHT, and as Patrick said, just very grateful that you have all taken some time away from your busy days to join us for this virtual celebration of our work together over the last year. So for the next 40 minutes, we will be covering the following agenda. I'll start with a light setting of the context, and then after some acknowledgements, we'll have speakers share reflections and provide an overview of accomplishments of the last year before I take us through some of what you can expect from your CND OHT over the coming year. You'll notice that this year's theme of primary care as the anchor of health is weaved throughout what is shared today. And as we move through today's program, reflecting back on accomplishments and also thinking about the year ahead, I would invite each of you to think about what success will look like for you over the coming year. When you think about June 2025, what will we have to celebrate together? What theme might we be highlighting? And so I'd like you all to prepare for a brief moment of audience participation at the end of the session, because we're going to be using the chat feature to share responses to the following question. When we come together next year in June 2025, what is one accomplishment that you hope we will be celebrating? So as you start pondering that question, let's jump right into today's program. So looking at the faces on my Zoom screen, you've all been involved in OHT planning for at least the last year, if not for the last 4+ years that our work has been underway together. You all know that Ontario health teams integrate care and use equity-based population health approaches to deliver better health outcomes and provide better experiences for patients and clinicians. The CND OHT developed our inaugural strategic plan, feels like way back in 2022, which set our shared vision of a community where people access seamless and integrated services to ensure the health and well-being of our diverse populations. With a local focus and a commitment to equity, the CND OHT uses a collective impact model to co-design improvements for the Cambridge and North Dumfries communities. Now, before I pass it on to our speaker, we do have a couple of leadership transition farewells, which are always hard to do. So I do want to acknowledge and thank those who are stepping out of our formal leadership structures at the CND OHT. So first, Lucy Santamaria has now completed her 2-year term as the inaugural chair of the Patient, Family, and Caregiver Advisory for our OHT. Lucy has approached her role with kindness, curiosity, loads of patience, contributing to building both formal structures for the sustainability of the PFAC and the OHT, but most importantly, by fostering incredible relationships amongst PFAC members. Lucy, thank you so much for everything you've contributed. We're grateful that you'll be continuing on our PFAC as a member in September and look forward to seeing you again then. Next, Dr. Pengelly will be stepping away from the Joint Board Committee and stepping down from her role as one of the 2 inaugural vice chairs of that group. Dr. Pengelly brought a strong primary care voice to the Joint Board Committee, highlighting opportunities and impacts of OHT efforts on primary care clinicians. Thanks so much for all of your contributions, Sarah. Dr. Tamara Halling is also stepping down from her role as chair of the Frail Older Adult and Medical Complexity Workstream, a position that she has filled graciously for almost 3 years. In that role, Tamara brought a unique perspective as an expert in palliative care, as a clinician conducting home visits in the community. And under her leadership, the workstream oversaw the development of the soon-to-be live Healthy Aging portal, as well as the advancement of population health initiatives. And thankfully, we're not losing Tamara completely as she continues to be active on the CND OHT steering committee. And we look forward to her continued leadership in that capacity. And finally, an acknowledgement to Dr. Kanakri, who we knew would not be with our team for very long, but we hoped might never leave us. Thanks, Canuck, for all of your contributions to the CND OHT in your 9 months with us. You helped us advance several population health and primary care initiatives and contributed to building a strong, sustainable foundation for the CND OHT primary care network. And as this is Canuck's last month with the CND OHT, I asked him to provide some reflections today. And in some ways, it feels a bit like a graduation valedictorian address. And I think that I can confidently say that our staff support team would probably vote Canuck as the valedictorian of this year. Right, Brenda? I see your face. Both a standout strategic leader and highly regarded, kind, and empathetic team player, Canuck has been an absolute gift to our staff support team and to the CND OHT as a whole. And so with that introduction, and before I shed a tear, I will pass it over to Canuck to share his remarks for today's celebration.
Thank you so much, Christina, for that kind introduction. My name is Canuck Ree, and as Christina mentioned, I'm a family doctor and the outgoing population health lead at the CND OHT. Today, I am zooming in to all of you from a teaching unit at the University of Toronto, where I'll be spending my life after the OHT teaching the next generation of PGY1s and PGY2s in family medicine. And I was asked to share, as Christina said, a couple of learnings from my time at the CND OHT. And as I thought about this request, I reflected on my all-time favorite TEDx talk on leadership. Mr. Peter Anderton posits in his now famous 2016 TEDx talk that 16 centuries of leadership knowledge can actually be distilled down to 2 things, believe it or not. So first, leadership is not about you. And I think about servant leadership or leadership in service of others. It's an ethos that really defines leaders that I personally admire. The second thing he says, of course, is that leadership is all about you. And many of us are probably reminded of Dr. Albert Schweitzer's famous quote, "The three most important ways to lead people are by example, and by example." That was a quote that I think every healthcare leadership conference that I can recall started off with. So leadership is not about you, and leadership is all about you. And it's with this inspiration that I humbly share my 2 lessons of effective organizations that I learned right here at the CND OHT. So first, the little things matter. And seemingly paradoxically, second, don't sweat the small stuff. And I'll start with the little things matter. It's really self-explanatory. But before I do that, I see Donna Gravel on the Zoom. So many physicians at the Cambridge North Dumfries community have told me on countless occasions that they remember her small gestures, her attention to detail that she brings to creating real connection for prospective doctors to the region. And as I think about Donna, the CND OHT also, in my mind, is all about people, building bridges and relationships, then catalyzing ideas within these newly formed co-design teams. That attention to every detail, whether it's a website like the one Christina mentioned to support frail seniors, we call it HARP, the Healthy Aging Resource Portal, or whether it's one of the 4 primary care network engagement events that we've had so far this spring. The details and the points of connection really do matter. Sitting around for an hour after the meeting ends to continue to harvest the amazing ideas that pour out from our primary care providers matters. Carefully taking these ideas over to the OHT team to cultivate them matters. The little things and how you approach them sends powerful messages and powerful signals to the system, I believe. Messages like, we want to invest in clinical leadership. Messages like, we want to create an environment where experimentation is supported, and that we want to showcase the attention and excellence that we put into every task. The second message, as I stated earlier, is don't sweat the small stuff. Of course, this refers often to the scale at which our CND OHT operates. It acts as a glue between sectors, finding elegant ways at times to solve really complex problems. And doing that means not getting held back by conventional barriers. An example that really comes to mind, servicing the preventative needs of equity-deserving patients doesn't need to occur in anything resembling a Ministry of Health approved primary care model. No. The CND OHT's pop-up PAP clinics are mono-service lines or focused factories that have evolved from storied, made in Ontario institutions like the Ottawa Heart Institute, which focuses on cardiovascular health, and the Sunnybrook Orthopedic and Arthritic Hospital, which just focuses on hips, knees, and shoulders. Not sweating the small stuff, I think, also refers to the organization's constant engineering for creativity. Because what is the next CMAC? What is the next Cambridge Mental Health and Addictions Clinic going to be? We know that CMAC was originally built by primary care for primary care. In many ways, it was an evolution of another made in Ontario ideal, the ideal of shared care that works so well, we know, in cancer survivorship, so well in obstetrical care. And I believe we need to build more bridges between specialized care and primary care. And it is indeed long overdue in mental health and addictions. In every other organization I've worked in, whether it's in Cambridge or in the GTA, our job in healthcare was always to take our patients, our staff, our healthcare facilities from point A to a clearly defined point B. That really, really hard work of building consistency and standardization along that path. But the CND OHT, I found, our job from morning to evening is to design a journey from point A to a place that probably doesn't currently exist, at least in Ontario, I think. That creative process at the OHT often starts with a half-baked idea that gets better and better, week after week, month after month. It's as one of my favorite authors, Dan Coyle, says, it's a never-ending process of trying, of failing, of reflecting and learning. He describes also that high-purpose environments like our OHT here are dug out of the ground. And I see the CND's work as a non-stop process of unearthing the integrated healthcare solutions that will serve Cambridge North Dumfries for the next decades to come. I want to end with a note of gratitude to the CND OHT team that has supported me in every step of my journey, my courageous boss, Christina, and her board, steering committee members she serves, and the primary care teams and clinical and health system leaders, especially those providing leadership on the CND OHT co-design groups and the PCN that have welcomed me from the very beginning. So thank you, and I'm happy to pass it back to Christina.
Fantastic. Thank you so much for those reflections, Canuck. We so appreciate it. Now, speaking of primary care clinicians and involvement of primary care clinicians, I certainly want to recognize the contribution of those over the last year. And I'll start with recognizing Dr. Camilla Singh, who is feels like a lot of inaugurals, which makes these roles even harder, our inaugural CND OHT primary care lead. And Dr. Singh, with passion, has engaged her physician and NP primary care peers in forming our primary care network. And so really want to thank Dr. Singh for her leadership. We also want to pause and thank our co-design group chairs, Dr. Albrecht, Dr. Kumanen, Dr. Holling, Catherine Loveday, who are all frontline clinicians in primary care that dedicate time to building our OHT. And also a shout out to some of what we're calling our primary care network founders. I think Canuck coined the term just this morning, to Dr. Gupta, Dr. Kular, and others who have come to those meetings and put in the time to start to conceptualize how do we self-organize primary care for Cambridge North Dumfries. Huge thanks to you for all of your efforts over the last year. And the next slide here depicts for you a visual that I wanted to highlight. Some of you might be surprised to hear how involved primary care has been in our OHT structures from our very inception, and only been that representation and that engagement has only been strengthened over the last year. And so you'll see here, we actually have primary care clinician leadership, representation, and administrative representation scattered throughout our OHT structures, from our implementation and planning groups all the way up to strategy and decision making. And this is quite remarkable. It's quite unique for our OHT. And I want to thank those clinicians who sit at all of these groups and participate so actively in our OHT, and also wanted to make sure that there was awareness amongst all of you. This is something we should all be very, very proud of, about the involvement of primary care in our OHT development. Now let's talk about accomplishments. Lindsay Boerman, who is our performance monitoring and quality manager, will be providing us with a bit of a reflection from our accomplishments and impact over the last year. Over to you, Lindsay.
Thanks so much, Christina. I'm thrilled to be able to share some of our accomplishments from our OHT from the past year. And we'd like to highlight 6 important projects that we're especially proud of. Working with the Registered Nurses Association of Ontario, the CND OHT is implementing evidence-based best practice guidelines to improve care in our OHT through the BPSO program. To date, we've hosted 2 kickoff events and 3 planning meetings, including an in-person workshop. And we have 20+ participants involved in this work and is supported by Cambridge Memorial Hospital and Lanes. Our Collaborative Quality Improvement Plan, or known as our CQIP, represents our shared commitment to quality. And this year's plan highlights our progress in improving preventative care and mental health. We're taking a bold approach to addressing preventative care by setting ambitious targets of 10 and 20% improvement. Moving on to system navigation, Angela Martin, our digital health lead, has been co-leading our system navigation work. And in collaboration with KW4 OHT, we have established a system navigation community of practice. comprising of approximately 40 to 50 individuals from over 20 different organizations in the Waterloo region. It's effectively breaking down silos within the healthcare system. So huge shout out to Angela and Jessica Lemon for leading this important work. Of course, with online appointment booking, we're continuing to advance our digital health agenda through opportunities to make accessing care easier for patients. Over 98,000 patients in Cambridge North Dumfries have booked online appointments, and 70 plus primary care partners are now using online appointment bookings in our OHT. We're very proud of our grassroots approach in Cambridge North Dumfries and our community partnerships. And one way that we're doing this is through the Pop-Up PAP Clinic project. Working with Cambridge Community Association, the Nurse Practitioner-Led Clinic, Langs, and Public Health, we're making preventative care screening more accessible. And to date, we've hosted 5 screening clinics, and a huge thank you to the Waterloo Region Nurse Practitioner-Led Clinic for hosting these clinics and their support of this project. And to date, we've supported 12 patients. Each of these patients now has access to long-term sustainable primary care in their community. And last, but certainly not least, we have been working to support primary care. And the CND OHT has initiated the development of the primary care network, and we've engaged with more than 30 physicians and nurse practitioners to date. We are listening to primary care and supporting them with meaningful quality improvement projects, such as improving response to death calls, as well as improving referrals to specialists. Back to you, Christina.
Thanks so much, Lindsay. And for those of you who would like to learn more about our 2023-2024 highlights, you're welcome to visit our CND OHT website, where we have posted a one-page summary of what was shared today. It's easy to find on our main page banner. There's a quick link there, and you're invited and encouraged to share that overview broadly, whether with your teams or with your neighbors. Now, looking ahead, in the last month, all Ontario health teams across the province were provided with agreements to confirm our mandated 6 priorities for the next fiscal year. So for those who are interested in what those are listed there for you on your screen. So you can see we have 6 priorities from population health management, system navigation, all the way through to data and digital health priorities. As per yesterday's Ontario Health West Health System Partner Call that some of you may have attended, Matthew Anderson, President and CEO of Ontario Health, confirmed these priorities, highlighting that Ontario health teams will continue to be critical in advancing integrated care in the province. In addition to advancing these required priorities, the CND OHT continues to be committed to making progress on our collective commitment to local solutions to local problems. This includes moving forward priorities identified in the CND OHT strategic plan, and also in addressing emerging issues identified by our communities, by our OHT members and clinician partners, such as fall surge planning and respiratory season preparedness. We are very proud to continue to be responsive in our collective impact approaches and continuously strive to address both the building blocks to health system transformation and integration, while also seeking to make meaningful improvements for our communities. So now returning to that final audience participation moment, which I hope you will all participate in. You are the Cambridge North Dumfries OHT. We together are the Cambridge North Dumfries OHT. And we want to continue to add value to you, to your organizations, to your neighborhoods, to your communities. And you might remember, as I was introducing today's agenda, I asked you to ponder the following question. What is one accomplishment that you hope we will be celebrating when we come back together next June? And I hope you can all use the chat to share that one accomplishment. We'll be keeping track of your responses, and I look forward to using them to inform our work for the year ahead. And as you put those in the chat and share those, I am going to pass the mic over to Chris Castellato, our steering committee co-chair, for closing remarks. And as I do that, I want to take a moment to thank the staff support team of the CND OHT for organizing today's event, and particularly to Brenda and Hava for their role and their leadership. With that, Chris, over to you.
Great, thanks, Christina. So I definitely encourage you to add to the chat and answer that question that we'll keep on the screen there. So you're welcome to do that. And really thank all the speakers today. Some great information, and what a great year we've had so far. So wanted to thank all of you for joining today, this celebration. There's certainly lots to be proud of. We hope that as a member of the CND OHT, you're as excited as we are for all this year's accomplishments, as well as what's to come in the next 12 months. We encourage you to bring back the information and the things that you saw today, learned today, back to your individual organizations and share them. It's great. The more people we can have engaged and the more people that we have coming to meetings and being a part of this, the better we'll be. And a big thank you to everybody that joined today, as well as the OHT support team, Christina and her team. So thank you for another great year of all the things that you do. We look forward to continuing to partner with everyone as we have many upcoming projects, and as our main goal, which is trying to integrate care in our community and continuing to build on that. So I see many great things popping up in the chat. Thank you so much. Christina will capture all of those. But again, in conclusion, I just really want to thank everybody for joining today and hope you all have a great afternoon.